pop star to UCLA Medical Center. There are numerous reports Spears has been placed on a 72-hour mental health hold because of concerns she had become a danger to herself.
I feel badly for Britney because she can't get the help that she needs, and there's so many handlers around her trying to control her life because she seems so out of control. Psychiatrist
Dr. Mark Goulston describes the process of treating patients who have been admitted under an involuntary mental health confinement, or a 5150 as it's commonly called.
Well, she's being evaluated. What does that mean? That there are a number of different mental health practitioners, from a psychiatrist to a social worker, possibly a psychologist, speaking with her, interviewing the family, trying to get all the facts together so people don't jump to conclusions.
Hollywood TV captured this video of Spears' father, Jamie, as he arrived at the hospital early this morning. There have been reports that Britney's parents have been trying to get some control over their daughter's seemingly uncontrolled life. This is the second time this month Spears was taken away from her home by ambulance. On January 3rd, police were called to her house when she refused to return her 2 young sons to ex-husband Kevin Federline, who has custody. And now there are criticisms being leveled against the LAPD about the extra resources used both times for transporting Spears to hospitals. The LAPD responded with a statement this afternoon saying, quote, "Due to previous overly aggressive actions of some members of the media, and in particular members of the paparazzi, the department utilized a number of resources to support the transport of Miss Spears in a safe manner." And if all goes as planned here at the hospital, she will receive a diagnosis, treatment, and medication if necessary, but she is not expected to be released before 3 days is up. Reporting live at UCLA Medical Center, Leslie Sykes, ABC 7 Eyewitness News.
As we told you at the top of the newscast, Britney Spears is hospitalized again. Her family has said she's suffering from bipolar disorder. And for a closer look at this condition, we go live to Eyewitness News reporter Giovanna Lara at UCLA Medical Center. Giovanna.
David, doctors say bipolar disorder affects 2 million Americans. We talked to a psychiatrist today, and he gave us more insight on the disease.
Bipolar disorder is a mood disorder as opposed to a thought disorder, meaning it affects people's moods. And it's bipolar, meaning that your moods can be either up or they can be down.
Dr. Mark Goulston says unlike regular mood swings we may all experience, the manic and depressive cycles of bipolar disorder are intense and can interfere with daily life. It's more than a fleeting period of just feeling good or bad. An episode can last for days, even months. But someone who is bipolar might not even recognize the signs and symptoms of the disorder. During a manic phase, people may feel invincible, have an inflated sense of self, even delusions. They may experience euphoria, almost feeling high and extremely optimistic. Another symptom, extreme irritability, sometimes showing aggressiveness. They may have a decreased need of sleep, often sleeping just a few hours a night. And during a manic phase, they may engage in high-risk activities like sex, drug, or alcohol use.
One of the problems is for bipolar patients is they don't like medication often because it takes away their highs. Because when you're feeling high, you're feeling good. You feel like you could do anything. And often they will only consent to the medication when they're going into a depressive phase.
In the depressive cycle, some of the signs are that a person loses the ability to experience pleasure, has no interest in anything. They may lose or gain a lot of weight in a short period of time, and they may feel physically drained, exhausted, almost like they can't get out of bed. Being in the depressive phase may also make someone feel distracted, unable to focus or concentrate. But is Britney Spears bipolar? There are reports family members believe she is.
If they decide that she is bipolar, they will probably come up with a course of treatment of some medication, either starting with something like lithium or trying one of the other medications for bipolar disorder.
Now, Dr. Goulston says lithium is the gold standard for treating bipolar disorder. However, patients have to cooperate with doctors when they are taking lithium. They have to follow up for medical tests, and often bipolar patients do not want to cooperate. They don't want to go in for these tests. So now doctors are turning to new drugs like anticonvulsants, which are used to treat epilepsy. We're live at UCLA Medical Center. Giovanna Lara, ABC 7 Eyewitness News.
Giovanna, the seemingly downward spiral of Britney Spears continues tonight. For the second time in a month, the singer has been physically removed from her home by police, and Spears has been committed to a hospital psychiatric ward. Eyewitness News reporter Leslie Sykes is live at the UCLA Medical Center with more on Spears' condition. Leslie.
Well, David, the hospital will not confirm or deny that Britney Spears is here, but by all indications, she is under what's called a 5150, and that's where a clinician or a police officer can have a person involuntarily confined for up to 72 hours in a hospital if that person is deemed a danger to himself, herself, or to others. And there are also reports that Spears' psychiatrist initiated the intervention. In a scene reminiscent of one earlier this month, nearly a dozen police units, an ambulance, and helicopters escorted Britney Spears from her Studio City home to the psychiatric wing of UCLA Medical Center early this morning. There are numerous reports Spears has been placed on a 72-hour hold, or a 5150 as it's commonly called. Members of her family have said the 26-year-old pop star suffers from bipolar disorder, something psychiatrist Dr. Goulston says can be exacerbated by celebrity.
You really are an exception to the rules, so it does contribute to your feeling that you are different from other people. It also causes you to feel, I think, isolated, because you really don't feel you can trust anyone.
Hollywood TV captured this video of Spears' father, Jamie, as he arrived at the hospital early this morning, surrounded by a storm of cameras.
One of the tragedies here is there's so many people with regard to Britney Spears who want a piece of the action, that they're robbing her of peace of mind.
And now there are criticisms being leveled against the LAPD about the extra resources used for transporting Spears to the hospital. The LAPD responded with a statement this afternoon saying, due to previous overly aggressive actions of some members of the media, and in particular members of the paparazzi, the department utilized a number of resources to support the transport of Ms. Spears in a safe manner. And if all goes well here at UCLA Medical Center, Britney Spears should be receiving treatment, a diagnosis, possible medication, but will not be released for another 3 days. Reporting live at UCLA Medical Center, Leslie Sykes, ABC 7 Eyewitness News.